Hi, this is Dr. Bob Montes, and I'd like to take a minute to talk about one of the tools that we have in our program with NewBrain. You may have seen when looking on my website at drbobmontes.com that we have a product known as NewBrain. NewBrain was the title I gave to a series of programs that I use at my office to be able to help folks get better. Just our brains are constantly inundated by so many things, whether it be things related to our emotional issues, going all the way back to things like head injuries and things of that nature. Well, a part of what we do in NewBrain is called Neuromodulation Therapy. I usually refer to it as Neuro-Stimulation Therapy, or I just call it STIM for short. Now, we have 4 different methods that we use in STIM treatment specifically that I'd like to talk about. The first one is called transcranial alternating current stimulation. This type of training is done by connecting an anode and a cathode, or a positive and negative charge, to the brain along a certain frequency in order to help that frequency within the brain. So in one of my other videos, I talk about the different frequencies that we have in our brains, ranging from delta, a very slow and slow sleep wave, all the way up to beta and gamma waves, which actually are those fast thinking waves. Well, this type of treatment addresses problems in any of the frequencies. So if we have, for example, a person with a sleep problem, we're able to help in that frequency by setting up the transcranial alternating current to simulate a sleep wave that's better for the individual and that's more healing. Then the brain entrains to it, or leans into it, and actually matches those brainwave patterns, and then the result of it is that they will sleep better. And the other type of therapies that we use include direct current stimulation. We often use that when there are some specific issues that we need to address more directly. What we mean by specific issues in this case would be something like migraine headaches. An individual who has a migraine may find most of the activity occurring at the top of the cranial region, and what we do is we send a current out toward another area of the brain. So we send a direct current, almost as if we're saying, okay, follow me out of the brain to another part of the brain. That particular treatment is really quite effective for a number of other areas. It actually can enhance learning. It can help people with direct issues associated with, specifics like math or English or things like that. It can even help enhance language learning. So it's a very effective tool to improve or enhance individuals. Another type of treatment that we have is pulsed electromagnetic field therapy, or PEMF. Now, PEMF is using magnetic stimulation, which is very gentle and really not felt in the brain at all. But one of the benefits of it is that it has more of a global effect. So we put some of the coils on different areas around the brain, and it'll have a very nice, easy, gentle approach to reducing certain levels of frequencies, such as those that have a very high amplitude. We're able to tamp that down really nicely. We're also able to raise the amplitude in the brain for those who have, what we call the blue brain, which is like low power in the brain. Another type of treatment is called random noise. We use random or white noise. And what we do is we use the currents to be able to also undo some neural pathways that have been stuck. So people with OCD, or people who have problems, not being able to resist urges and whatnot, such as addictions, would benefit from using this type of treatment because it will reduce the pathways that have been so grooved out in the brain. It tends to change those pathways or mix it up enough, and then the brain can create new pathways. So we have those treatments and a few others. I think a lot of people just really love this aspect of New Brain, primarily because the first way, which is really doing more of a feedback and the brain working on its own, this does a little bit more in pushing the brain in the direction that we want it to go. So call us at 678-366-8862 if you want more information, or just go to my website, drbobmontes.com. Thanks.